I'd like to introduce Dr. Robert Fischer, who is a research associate professor at the Jack Joseph and Morton Mandel School of Applied Social Sciences at Case Western Reserve University. He's also co-director of the Center on Urban Poverty and Community Development there, and he leads the center's efforts in regards to evaluation research. Also, since 2001, he's led the center's research on Invest in Children, which is a countrywide early childhood initiative that includes home visiting, children's health, and child care components. So today what he'll present to us is leveraging policy and evaluation integrated data as a tool. So please welcome me in joining Dr. Fischer.
Thank you, Jill. Good afternoon, everyone. It's good to see you. Thank you for coming out on a cold afternoon for a little data discussion. So I'm really pleased to be here. I want to thank Laura and her team for inviting me to talk. I think this is exciting, the work that's going on here, and I see us as colleagues on a path to what I hope is our objective around informing action, policy, and programs through use of data. And I want to share with you what has been underway at our center for now a decade plus, and certainly a work in progress, certainly something that continues to take a lot of attention and resources. So what I want to hit on is why we're focused particularly in this data discussion on the early childhood period. One of our chief aims is understanding the influence of neighborhood on children's trajectory through the use of data. And as part of that, we didn't really start this work to say, hey, we're going to do an integrated data system. Our intention was to provide a data backbone to help us conduct evaluation research on programs. And as part of that, we started amassing, in a way, administrative data from partners and then linking those together at the child level. And I want to illustrate some examples of where the kind of data that we've been able to produce has been very influential in decision making. So I kind of loved the big data terminology at first, and now I hate it. So I'm hoping, I'm going to switch to integrated data away from big data, because now it's out of control. And if you Google big data on Google, you're going to find all kinds of insanity out there about this. But I think what's important is partly the advent of technology that allows us to work with data that formerly we couldn't really have done much with. And so this opportunity has changed the way we can see data that has been with us perhaps for decades, but now we can do things that we never anticipated analytically. So this author arguing that it's kind of like when they developed the telescope, and being able to see at a new level of granularity patterns that we might have missed in the past. I think this is a risk for us. How's that big data project coming along, Hoskins? He's crushed under the weight of the big data, and that's another risk, is that we have a lot of expectations when we enter this dialogue, and it's a lot of work. As much as it sounds like a sexy thing to do, it's quite can be quite frustrating. So when I'm talking about big data, we're really talking certainly large numbers of records. I'm not talking about some of the more challenging examples on big data where they're looking at Uber transactions and credit card activity, and where there's many thousands of records. I'm thinking about something more mundane, and that is the experiences of children and families as they interact with multiple service systems and partners in community, and all the events and transactions that are created as part of that real life experience. So we have to think about how these records are produced. I'm not going to argue that now we trust these data way more than we used to in the past. We still have all the headaches around how clean these data are and how much we can trust them. But we have the opportunity to have these records be dynamic. So our system is continuously updated with records across children's life course up to about age 14 now. Lots of variability from many different data providers, and velocity there is the prospect when we can get our technology up to speed that we could be much more real time than we are. We have some examples in our center where we access certain data nightly from public systems, where we have a bot that goes onto a county website and screen scrapes off new housing information that's been posted by the county auditor. That's kind of the ultimate real-time function. Of course, if they would just give us the data as an extract, we wouldn't have to go scrape their system. So that tells you that we had a bad outcome with a data discussion where we couldn't formulate a data agreement. So lots of things. I'm going to illustrate this in my examples, but I want to talk about the role of geography in these data, and certainly the kind of snapshot data, the cross-sectional value of these data, and then finally the longitudinal nature of them. So this is as a parent, this is kind of, I was thinking about how does early childhood work. You've got all these institutions and programs in community, and to varying degrees, families, start at a hospital and they end up at school. And they might interact with multiple this is supposed to be home visiting, by the way, Winnie the Pooh, doing a home visit. Hopefully we're not going to be in child protection or the courthouse, but some of the, maybe public housing, all these places where children either reside or their families are served in some capacity. So what we're trying to do is identify all those places where there's interactions, where data are created, and then if the opportunity exists, how to bring those into an integrated analysis framework. So big lift, right? We didn't say, oh, we're going to do big data, and a year later we had a system. We've been investing in this for 12 years. And we have people contact us all the time and say, how did you get that data? How did you get schools data? How did you get Medicaid data? How did you get housing authority data, lead data? We didn't at first. We asked and they said no. And we asked again. And then the person who was in charge changed. And then we found some allies in the federal government who agreed with us. So it was a process. And we won. Eventually we outlasted the people who said no. We could point to all the reasons why it could be done and it should be done. And eventually we got the data. But it wasn't, when we first started, we had maybe 6 partner organizations who were already sharing data with us. And now we're at about 20. But we have lots of challenges analytically. Once you get the data, we just got a data agreement this week with the Cleveland Housing Authority. So now we want to look at the experience of children living not only in public housing estates, but if their family has a housing choice voucher and they're moving into inner ring suburbs. So being able to see where they're living is critical. Well, we have the data agreement. I don't know if we're going to have any data actually until this fall. It's a whole process of figuring out how we're going to get it and what format, and once we start working with it, they didn't give us everything we wanted, all those things. So transmission and understanding the underlying quality of these data is a big job on our side. Analytic tools I want to come back to. One thing we're trying to get more value out of is the visualization opportunities from these data. So really being able to see patterns that you might not have been able to see. A lot of that is geographic spread type, so real visualization in neighborhood, but could be, and there's some great examples around the country where you have multiple display of data, tables and lists of neighborhoods and the map. And as you scroll over the list, it highlights those areas on the map. So you can get it's not an analysis tool per se, but it does help you digest the tremendous amount of data that are represented in these systems. So I want to say there's quite a few partners now around the country working on this. There's this network called the Actionable Intelligence for Social Policy Network at the University of Pennsylvania, which we are a member of. And there are some counties, there's some state level integrated data systems, and a few cities working on this. And one thing I would mention to you is if you work with partners, only 2 of these systems are really aimed at integrated case management systems. New York City, for example. And the idea of having an integrated case management system where in real time I could look up a family and see what systems they're involved in. Obviously tremendously powerful, something lots of partners would like to have. Also tremendously expensive. Most of these systems are like ours, which are integrated, they're after the fact systems, integrated data for policy and planning and evaluation. So they're not about there's no certainty around the individual record and being able to tell whether one child got one thing or another. But it is about cohorts of children and clusters of children, and we have pretty good certainty around those experiences at that level. So with these different hosts, government, university, nonprofits, they're always talking about who should do this, who should be the host. We think universities obviously present a benefit. What our partners tell us is private entities don't want to share their data with government, that they're more comfortable sharing it with a university partner because they know we're doing it under institutional review board watch. Our hands are tied about doing certain things with the data. So we think universities are a good place for these to be hosted, but our ideal system probably would be that government integrate its own data and then provide it to us. Because if our county could integrate their own data from all their various departments, we wouldn't have to repeat all of that. So they would get value from integrating their own data, and then we could augment that with additional data that they couldn't have, for example. I'm not going to play this. It's a cute little video from our colleagues out in California, and it's a nice little, a very friendly version of what integrated data is. If you go to datanetwork.org, which is based in LA County, I believe, and you want to watch that later. I think it's about 3 or 4 minutes. Okay, so we got underway with our integrated data work back in '99, and our county set about what at the time was called the Early Childhood Initiative, which was a 3-year plan to invest heavily in early childhood services, 0 to 5. And they were combining some proven strategies like home visiting, high quality early education, preschool, and medical insurance outreach were their 3 primary legs to their plan. And then over time, as that became more solidified, they added some additional strategies around early childhood mental health, early literacy, low cost abatement. So they kind of built out and started to fill in some of the gaps in the system I use very loosely here. And as that came forward into the early 2000s, the county created an Office of Early Childhood and something called Invest in Children, which is basically the same thing as the Office of Early Childhood. And that has become the locus for control about enhancing supports and services for families with young children in our county. And that's been a great strength, although it is at risk because it's in county government. It is not a mandated function of county government. It's funded at the will of the people of Cuyahoga County. So it could go away, in theory, if there was a major change in priorities. So as I mentioned, we wanted to evaluate all those strategies that you just saw. And so we started collecting program level data. And we realized one of their aims was to change the landscape for children in our county. And as an evaluator, now we're not talking about the people in the programs, we're talking about the whole ocean of people in the county. And that suggests we need data on the whole population of children. So that led us to try to create an integrated data system that represented all children in our county. And we began very simply with birth certificates. Those were data that we were already receiving for another data system that we host, which is a geographic data system. We knew how to work with those. So we began creating a system that matched records against birth certificate data. So these are all identifiable records. We use probabilistic matching on about 12 variables: child's name, mother's name, dates of birth, address, gender of the child. We rarely have unique identifiers. Social Security number we don't have. So we're matching on fields available from our provider agencies, And we are, one of the benefits of integrated data is once you get a match of a child's record against one of the other things, it fills in blanks that may be in that original data set. And for example, if we can match a child to a Medicaid record, then we can match them to everything else because the Medicaid records are very reliable. We get them monthly. They're updated, so addresses are new. Whereas if we tried to match a child that is 5 now using a birth certificate, the address is likely changed numerous times. But with Medicaid data, we would actually have a registry of all that child, all the addresses for that child over those years. So our real aim here is to not just to evaluate, well, what's the benefit of home visiting or Medicaid outreach, but what's the context for children as they move towards kindergarten and beyond, and what do we know about those trajectories in various ways. So where are we at? We're actually closer to 500,000 children in the system now. These are the kinds of records that we include. I'm going to switch to the next one, which may be a little more accessible. So again, thinking about that movement to young adulthood and all of the systems that might impact a child's life. So home visiting, child welfare, Medicaid, preschool, special needs child care, SNAP, food stamps, getting to kindergarten, crawl scores, kindergarten readiness scores, public school records, are they in public housing? All these are systems that could theoretically provide additional information about a child's early development and experiences. But you can quickly see that there are going to be some children who will not appear in any of these. Some children there may be a birth certificate and we may never see them again. They lived in a well-off family, they didn't need any public supports, they went to a private school or a charter school, they went on to the workforce. So those kids won't show up here. The ones that show up are the ones that have had multiple interactions with support systems. So that is a limitation for us throughout. But if you want to know what happens to children in Cleveland who were born in certain neighborhoods, you're going to have high usage of most of these systems. So we're not worried about the kids who don't show up. They're not the ones that need additional attention and policy and planning intervention. We're worried about the ones who do show up. So we're making use of what we can know, and I'm always wringing my hands about what we don't know. So one of my biggest problems right now is we have Cleveland Schools data, we have 30 other suburban districts, public districts in our county. So we have now 6 of those 30 that have agreed to share data with us. Got to get the other 24. And then we have some neighborhoods where as many as 40% of the low-income children are choosing a charter or parochial school. All those kids disappear from the system. So we have to find a way, particularly for subsidized charter schools, to have those children represented in here because they're using public funds, and we should be able to see what their kindergarten readiness and 3rd grade proficiency test scores look like coming out of those experiences. And then I'll go to, oh, look what they did. Fancy. This was done by a programmer. He said, get away from that. That last one was too touchy-feely. Here's what child really is. These are different domains of data. And then now that's supposed to do something. These come together and we have this single record. We have, as we match a child individually into the child system, they receive a unique identifier that becomes the way we manage the data. All right, I'm actually going to skip the next few, and what I was trying to illustrate with these next few was that all of the things that we used to do from those data, we can still do. So geographic analyses, this is poverty, and we might use census data for poverty, but we also look at food stamp usage as a more immediate indicator. We can look at time trend data from our integrated data system, the percentage of children under 6 that are touched by various systems. So in 2010, we were nearly 70% of our children were on Medicaid at some point prior to age 6. About 50% born onto Medicaid, and the others. And food stamps has continued to rise in our county. So, there's still a lot of power here to do the kinds of analyses that we often stopped with before, geographic, cross-sectional. But I want to talk about a couple of examples now where integrated data have been very influential in informing decision making. So I think what I've tried to argue so far is a lot of power here in integrated data potentially. It helps us understand what I'm calling a system, but what we might think of more as a confederation. It's a system of systems or microsystems. I think it's comforting to say there is an early childhood system, but I don't get the impression that that's anyone's reality. So there are many places, many transition points in the early childhood period, many places where families fall out of our system. So if we think about all of those places where interaction occurs, we can get a much more complete view of reality, and that's what we're after here. So many of our partner organizations think of their families, these are the families we serve, and they tend to forget about all the other people who are serving the same families in some way, shape, or form. This gives us the power to see those overlaps much more quickly. And in a day and age where now our service models really reward a long-term kind of comprehensivity to our approach, if you think Promise Neighborhood, Harlem Children's Zone, that cradle to career mentality, it suggests that we actually could have data to help track that experience over a much longer time than we ever have. So this is consistent with some of our ethos on the practice side of the house. Let's solve this problem by using the big data none of us have the slightest idea what to do with. That is what happens. Now in meetings, people say, oh, well, Case has the data. Case has our data, as if that answers the question. And it is nice to know that your data are part of, or at least available for analysis. But most of our questions that get asked, they have to be refined in order to use integrated data to answer them well. And many of the questions start out in a very raw form. So the examples I want to share with you is looking at children who potentially are not using well child visits, particularly in the first year of life. A case where we were involved in predicting school readiness and trying to understand the value of high quality preschool. And then the third one is, most recently, we've been involved in a pay for success development in our county, where this is a social impact bond type approach to private fundraising by government to invest in pilot strategies. And if it pays off and saves the government money, the investors get their money back with interest. So we are the data partner on that. So first on this child health piece, in our county we had been tracking children health insurance coverage for many years, and everybody was excited when it was 96% of kids under 6 were covered in some form of Medicaid. But when we looked at medical usage, particularly well child visits, we found that only less than half were getting the recommended number of well child visits in the first year of life. So we went to the integrated data to ask the question, okay, well, they're not getting their well child visit. Are they involved with any other service partners during this same period? And what we found was that half of this 43% were involved with other service partners at the same time. Home visiting, child welfare services, WIC, a range of different partners. And the goal from the partners was, well, great, CASE can tell us when somebody misses their well child visit, and then we'll go to the home visitor and say, hey, can you contact the family? Except there was one problem. We don't get these records until a year later. Right? So if they will have missed all their well child visits way too late. So I mean, maybe in some future life we'll be able to have some kind of early warning system that would inform this. But right now, that's not a solution. So what they ended up doing was finding clinics that had high rates of missed well child visits, and they employed new staff, front-end staff in those clinics to work directly with families to keep them engaged. Because one of the concerns that came up was families didn't feel connected to their doctor. And if they're not going to connect with their doctor, could they connect with another staff person in the office? And they basically showed that they could double the rate of completion of these well child visits in the first year of life with this investment. Now, obviously, this costs money, this strategy. One of these programs has continued and expanded it. The other one lost its funding and it went away. So just figuring out, a strategy and giving people data to make a better decision doesn't mean that it's going to end the way we necessarily want. I want to share the second one, which is this on the school readiness front. And here we were part of the Ohio Education Research Center based here at Ohio State. And we were funded to look at the implications of the third grade reading guarantee by using integrated data following 4 cohorts of kindergartners in Cleveland, following them in the sense that we found them when they enrolled in kindergarten, and we use administrative data to follow them back to birth. So a retrospective look at their early childhood experiences, and then prospectively following them to third grade to see what their passage rate was. So all of this done in about 18 months. We already had all the data for the cohorts prior to kindergarten, so no new data collection. Only the third grade proficiency test scores were needed, newly collected. So we just finished the report in December, and what we found was confirmation of many of the factors that have been shown for the literature on outcome of kindergarten readiness and third grade proficiency, so maternal education, poverty. But we found some very important effects related to specific service strategies, like the newborn home visit, which is done by a nurse, so something done within the first year of life, actually having a significant effect in regression after controlling for everything else, significant effect on kindergarten readiness. Now, our partners are worried well, how can you say that 2-hour home visit by a nurse significantly impacted kindergarten readiness? Well, we think it's the receipt of the visit as a marker for families that have other things that would suggest they're going to get there in time. So it's not really the visit itself, it's the fact that the family accepted the visit. And we have some others that are much more home visiting in general shows a positive effect. High quality preschool shows a positive effect. Low quality or unrated quality programs actually show a negative effect in our model. So there's it causes, this one we've supplied, and we're working with the Cleveland School District around how to help principals in individual school buildings better meet the needs of their children. So this was an overall model with about 16,000 children, but we can drill these data down to individual buildings and say, well, Principal Jones, here's the characteristics of the kindergartners you had last year, and here's who you're serving. Does your model still make sense given the circumstances that these families are coming from? So we looked at that sample again, and what we know from our work studying children in high quality settings in Cuyahoga County, just looking at the kindergarten readiness assessment for literacy. On the far side there, you have all kindergartners entering the Cleveland School District. You have children who were in our universal pre-kindergarten program, so you can see some elevation there. These data also allow us to look at the dose of service, the actual attendance rates at these programs. So we defined a group of kindergartners who had a high dose of high quality preschool, and we see even a higher rate for them. Still below the county, still below the statewide average on the crawl. And we got a new measure, we got the craw now, which is, so we have to transition from our old way of measuring this to the new way very shortly. And then I'm going to finish with this third example, which is the Pay for Success case, which is focused on homeless families with children in foster care. I'm not going to advocate Pay for Success as a financing model. I mean, as a social scientist, as an evaluator, I don't worry about where the money came from. If they want to raise it from private partners, I'm excited to hear that. What I'm excited about is high quality strategies to change the lives of families and children. And when we heard that homeless families with children in foster care was their interest group, we immediately signed on to help them with the integrated data. And what we had to show them was that the population that they were interested in was sufficiently large and costly enough, meaning that they were already using a bunch of, costing the county a lot of money, that they could field this Pay for Success project and save enough money to pay back the investors. So we did this analysis in 2014. They launched January 1st with this is a 5-year study of this intervention. So we used the integrated data, primarily looking at our homeless management information system data and child welfare data. And we linked those records together, which we hadn't done previously. And one of the biggest obstacles to that is the homeless system sees their service unit primarily as adults. And over here, the data are organized by children. And what we found is that because most of these moms, when they went to the homeless shelter, they already had children in foster care. They may farm out their other children to family members so they don't have to take them to shelter. We had to kind of use detective work to piece together family units from these two systems. The homeless service system saw them as single women, maybe with one child. Turned out they had 3 other children, 2 in foster care, 1 living with another relative. So to create units of analysis, units of service delivery that could be the engine for change here. So the focus again is on reducing foster care stays. The kinds of analyses we've done is matching together HMIS, Homeless Management Information System data with SACWIS, which is the child welfare system. I mean, the numbers we're talking about, this original 647, about 700 families that were they were in the homeless system and in foster care, cost the county $18 million in a 2-year period in foster care expenses. So the potential money to be saved was big. And the service population is relatively small. So even with serving about 100 families in a year, the savings in foster care days of cost will be dramatic. About $80 to $90 a day foster care expense. So, but the thing in a school of social work, what we were focused on was cutting a 2.5-year stay for homeless children in foster care. And their intention, the plan for the model, they're using something called critical time intervention, which is a evidence-based model for homeless adults. Hasn't been tested with families, so we're doing something different here. But the goal is to reduce that by at least 40% with the specialized care. All right, well, I don't want to oversell this. I mean, I think everybody should do big data, but I think there's a lot of value here, but I don't want you to think that it's a slam dunk. There's some serious problems when working with our partners to begin this discussion. Not everybody comes to the table readily. Many have to be convinced and persuaded. It does take a long-term investment, so in our case, the county did commit. Foundations gave money to our county, who then paid us. So it was private foundations that put up the money for this work, and they made routine investments over that 10-year period to support us. My experience recently is that it's much easier to get somebody to pay you to start one of these than to maintain it. So what we're trying to talk to national foundations who want to invest in relatively mature integrated data systems to demonstrate the value of them, rather than just spend $1 million to build a new one in a region that doesn't have one yet. because I think we can reduce the cost of doing this if we could learn a little better on the back end. And you know, one issue for us is I love programmers and I love many of our quantitative folks, but we need to find more people with an early childhood sensitivity who also have the data skills to work with these many administrative data systems that we're bringing together. So there's a real need now, and at CASE we started an undergraduate minor or a major in data science, but that's an undergraduate degree. We need more professionals who are comfortable both on the data side but also understand what it looks like on the ground for children and families. Because when you get into these thousands and thousands of variables, you really have to be able to understand and talk. Costs money. I think my estimate is that about $4.5 million has been invested in this system over about 12 years. It's a little hard to parse out, but it does get expensive. A lot of data time. Access is a continuing concern, so we have our partners who are already sharing data and how we keep them happy. We have our partners who have said yes verbally, but we don't have a data agreement yet. And then we have the people who are on our hit list who have said no in some form. Head Start has been our biggest challenge over the years. I'm hoping for a breakthrough this year. And to think about the logistics of, you know, once you get the data flowing, how frequently do you want it? As I said, most of our partners, we would like to get them on a quarterly schedule where we get an update quarterly. Some readily gave us monthly extracts. Others were in good shape if we can get it once a year. So moving once a year data suppliers to quarterly would be a major win for us because that timeliness of the data is crucial. We found that this data discussion really does help people collaborate differently. So when we have our systems meeting with early childhood serving agencies, they can talk about referrals to each other and you know, cross-training and co-location and all these things. But when they moves to sharing data with one another for decision making as a group, it does represent a higher order of thinking about themselves. Because it's risky, right? No, none of us wants to share our data unless we have to. But once they get through that, we usually start, here's the way it usually starts. I ask, you know, how about you just share some of your data with us and we'll see how well we can match it to our system. And then if that works, then you go, hey, that's interesting. They start asking questions. When you start to get them to ask questions of the data, then that's the hook that maybe keeps them at the table. Then we have to think about where the money's going to come from. And then, of course, I'm going to change it from, yeah, thank you for that 1 month data. Now I need all your future data and all your past data. I mean, I really want the Ohio Department of Health, we had been working to get childhood lead exposure data for many years. And last fall, we got 10 years all at once. 10 years of lead tests all at once. Huge win. And that's really what we want. We don't want to sign something now and have data in a year and a half. We want, if you've had this system for 5 years, we want to go back to the beginning and see what we can get out of this. To me, this is the ultimate green experience. We're recycling. We've already spent all this money to collect these data. We are recycling it for new learning and the potential to impact policy and decision making. The last point there, obviously people are going to develop their expectations about, and we need to nip those in the bud, about how quickly you can answer things, how cheaply you can answer things. There's a whole community that's saying, and the administration included, we can do cheaper research by using administrative data. And we can eventually. But in the short term, it's going to take an investment to get the technology right and get the analytic tools right. So in the short term, it's probably going to cost a little more to answer some of these questions. So for us, what's next? We are going to do more of these longitudinal studies from our integrated data. We have a funding from the MacArthur Foundation to take that school readiness study that I mentioned a moment ago And what we're adding is housing experiences to early childhood. So for every child, we're creating a record of where they lived month by month. And then for those properties, we have our property system that tells us the quality of the house, and we have this archived. So we know the quality of the housing, whether it was ever foreclosed on, and what the neighborhood was like as they were growing up there. So we're hoping to learn what the influence of housing experiences is. And then I mentioned we're trying to fill the gaps. Head Start is a big one. Our partners with the Developmental Disabilities Board have agreed to work with us on data sharing. And then we're moving into adolescence. We already have juvenile court data, but as I mentioned, we have huge gap on our school side data. So we are the data partner for a Promise Neighborhood initiative in Cleveland, which has this cradle to career focus just for the central neighborhood of Cleveland. So that is part of the reason we have tried to build out this system at least to age 21 for those children that we can. All right, well, I think I will cease and we'll take a few questions if we could. I appreciate everybody being agreeable so far. Oh, thank you.